Yo, yo, yo. Hey guys, welcome back to another awesome edition of the Best Practices Show podcast. Our goal here is to bring you the best thinkers, best teachers, best dentists anywhere in the world to share some information to help you improve your practice and your life. And today I bring back a dear friend of mine, Dr. Jim Otten, and he asked the question, why would a patient choose you as a dentist? It's a question you have to answer to build an amazing practice. So please listen up. I hope you guys enjoy this, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. You know the jam around here. I get to work with some of the greatest minds, greatest mentors, greatest teachers, greatest dentists of all time in an effort to learn some great things on the podcast and share them with you so you can have a better practice and a better life. So keep showing up. We're going to keep bringing it. And today I have a dear friend of mine, Dr. Jim Otten, and his question is, and will always be, to you as a dentist, why should a patient choose you? Jim, thanks for being back, brother. I appreciate you.
Oh, man, appreciate being here, Kirk. You know, I told people I was going to be on today, and they go, well, how's Kirk doing? What's Kirk up to? They always ask about you, and, you know, I can work that out with my therapist, but I'm happy as hell to be here, so thanks for having me.
Well, that's very kind, brother. It's very kind. So this is a big topic. I love this subject. I think no matter what you do, you have to figure out the answer or be on the eternal quest of the answer to this question. But let's start really big picture. Wait. Actually, let's go back a little. I always like people to know who they're listening to. So give us a little bio. Who's Dr. Jim Otten?
So I was, like everyone else, coming out of dental school, thinking I was going to be big and I was going to be profitable just because I came out of dental school. And, you know, this was like 40 years ago. And so when I came out, I came on the same journey that everybody else does and wanted to be successful. And I was really energetic. And I never, you know, I always had a goal in mind of being the best and doing the best. And pretty soon I realized that there were a lot of people out there that were a lot better than I was. And so how do I get close to these people and learn, you know, something that was a little bit better than what I was doing on this treadmill that I really didn't want to be on? And so I practiced for 40 years here in Lawrence, Kansas. I've got a wonderful wife, Vicki, who's been by my side the whole time. My son, Craig, is now living in San Diego. My granddaughter is now 20 and pole vaulting at Cal Poly, and she's nationally ranked. So we got we have a lot of time that we spend trying to get out to see her. You know, aerospace engineer, pilot. This kid's just nuts. I don't know how she's my granddaughter, but you know, it worked out well. So, you know, I've been practicing a long time, and I think, you know, as you get older, and it is the gift of wisdom and some insight and some hindsight at that to see what's happened and the trends that have happened over time. In other words, you know, we've seen most of these movies before. Right. What trends in dentistry, but you've got to find out. What I had to find out for myself was, you know, what was my gift? I'm not your real left brain analytic. And it took me kind of a while to figure out that, yes, I was really interested in the technical part of dentistry, but I was interested more in the big picture. You ask me a question, I'll generally give you more of a philosophical answer, which may frustrate you. That seemed to frustrate many along the way. But that's just how I operate, right? So I had to turn that into something that really made sense for me. And what made sense for me was that I was always interested in sort of the medical part of dentistry, the bigger picture, how things really work, not just fixing the problem that was in front of me, but why did it happen? And unraveling all that. So my why became taking complex problems and trying to simplify it and share it with others, whether it be other dentists or patients. And so once you kind of figure that out for yourself, you get to be a lot more true with yourself, because I was, like the old saying, I was climbing the ladder of success and realizing it was leaning in the wrong damn building, and I was going, this is just frustrating for me.
Right. Absolutely. And as you start to do this work, as a dentist listening, like, let's go right there on the why of doing this. Yeah. Why, if I'm a dentist listening, why do I really, what you're really talking about is differentiation. As a dentist, you got to pick a path and you got to go down this path, but let's talk about the why.
Yeah. So you have to, the discovery process is something you have to step out of your comfort zone to do. And you have to step out of your routine to do. You know this. I mean, you've probably done it a whole lot better than I have over the years. But you've got to get out of your space and got to get out of your head enough to figure out what it is that really excites you. And I think that's the key, is what's the type of patient that comes in that you really get excited about seeing? And what's the stuff you really don't get excited about? Like for me, endodontics was just not ever in the picture. Forget it. I might as well have gone and tried to be an accountant if I had to do endodontics. And either one of those professions, I would not have lasted very long. It's just not my style. My style was to integrate things together. So you've got to figure out who's that patient that comes in that you really love the challenge, that you really love to see. Who are the people around you that you really love being around? And then you start to distill that into something that helps you define why it is you come to work every day. And I think that's the best way to start to approach it. And you can go through more formal processes, which I did through some of Simon Sinek's platform, to discover that, and it helps you refine it and define it. But it's really critical. I mean, why do you get up in the morning? Right. Why do you get to work? What are you trying to accomplish? And if you can't figure that out, then you'll get caught in a lot of the spiral of information that comes at you in dentistry, some of which is not healthy.
Right. So let's go back to that. So the spiral of information, there's a lot of information out there, whether it be on social, whether it be on some of these forums. I think it's harder. There's only one downside to dentistry right now. I think it's the amount of information. So there's almost too much information. So when I got started in this, you didn't have a lot of information. So you had to be selective about it. You had to choose your group, and then you test your group. And now I just feel like you can open up your phone and get too much information. But speak to that. What do you mean by, the spiral of information?
Well, let's look at it from any perspective, right? Social media has been, obviously a blessing and a curse in any aspect of our life. Yes, you can connect with people. Yes, it allows you to understand a lot of different things, but we're drowning in information and starving for context. We're just drowning in this stuff constantly, whether it's in dentistry, social life, politics. It's just a mass of data and information coming at us that we're trying to process and understand what really has context that is true and can be proven. So, for example, as much as I've resisted, I've had to go on Instagram and watch some things because I really want to know, what are people doing, right? And for example, my specialty, so to speak, or my clinical focus has always been around TM joint health and stability, and that foundational process that has to go on to help our patients have more predictable outcomes. So I watch a lot of stuff with people talking about joints and facial pain. So I go on the other day and I go, oh, this looks interesting. It's about Botox. Now, I use Botox selectively in my process, but this whole pitch was on how to deliver massive amounts of Botox into a patient's body, in order to solve their TMD problem. Now, if you're watching that, there's several things that should immediately come to mind. What do you mean by TMD?
Right.
Blanket term, garbage term, a whole garbage can full of different terminology that people use. It's not a specific diagnosis. And what are you trying to treat? Because if you're injecting Botox, you're doing it for two reasons. You're either going to paralyze a muscle to make it less functional, or you're going to use it to block the the receptors that create a pain level that's beyond some of the peripheral reception. Either of those things are valid uses, but that's not the whole story. Most of those patients, I would say, or at least many, I should say, have deep underlying structural issues that you're not solving. You're putting a Band-Aid on a cancerous lesion. You're putting lipstick on the pig. It doesn't work to look at things in that narrow of a band. And I kept thinking, well, why are they just talking about Botox? Because I started typing in things. Well, what about the joint? What about the structure? What about the diagnosis? Because there was never a diagnosis except muscle tension. Muscle tension is not a diagnosis, it's a symptom. Sorry, I'm getting a little excited. Yeah. It's a symptom. Well, this person these people with this massively worn teeth. How did they wear those teeth? It wasn't just muscle. The muscle's a reaction to something, a deeper problem that you have to discover. So I started typing in, well, what about this? What about this? My questions were quickly eliminated from the chat, because they didn't want to go there. And then at the end, they wanted to sell you the course on how to inject Botox. How much do you use? How do you draw it up? How do you mix it? Where do you put it? This and this and this for $997, you can have your online course and they'd mentor you through this. So what are you going to do when all you've got a hammer and everything looks like a nail? You're going to start feeding people Botox. And again, not that it's not an appropriate use, but without a fundamental diagnosis, it's disuse or I should say inappropriate use. So there's things like that go on. I had somebody call me the other day and said, I heard this at a seminar that people who use aligners have significant condylar remodeling. Oh, really? So the question you should ask is, well, what studies are there to prove that? Do you have follow-up preoperative and follow-up CTs, and have they done that in a large cross-section of patients? And has somebody else done it to prove that? And the answer was no, no, and no. So how do you make those statements? Now, again, can condylar remodeling happen with somebody that's in aligners? Sure. Is it related to the aligner? Maybe, maybe not. But you've got to find out exactly what you're talking about and not buy into these simplistic type of approaches to comprehensive care. But there are ways to do that.
Right.
So so there's just a plethora of information coming at you, much of which is just not accurate or incomplete.
Yeah. So what do we do with all this, Jim? So give us kind of a breakdown. I always love for people to have some type of a framework with this, because this is a big subject. So if I'm a dentist listening, like how do I start this path? Give me kind of a treatment plan for differentiation.
So the first thing, again, you've got to know what you want to focus on, because, if everything is important, nothing's important, right? So focus on where your strengths are. What are you curious about? What do you want to learn more about? Find what I would consider reputable sources. And reputable sources are people that have an ability to explain their philosophy of care. They have scientific literature where appropriate to back it up. Not, as Dr. Dawson said, not everything in the literature is true, and not everything that's not in the literature is false. There's clinical judgment, there's clinical experience, as long as you name it that. But find scientific evidence to prove or disprove what you're looking at and what you're trying to absorb, and then find people to help you apply it in such a way where you can see cause and effect results and not speculate. Have mentors that show you how to do this, and have programs that understand how to look at things in certain ways and break it down into measurable items and terms and specifics and specific diagnoses that you can identify, and then say, okay, of all this information I've gathered on this patient, what are the options? What's the best options? What's the risks and what's the benefits?
Yeah, absolutely. And you said your why. Go back to that a little bit more when you describe your why, your core focus behind your practice. And you and I talked about this before we hit the go button. This is really important for your team because if your differentiation effort is all about positioning yourself in the marketplace, your team might hear this the wrong way. They might see it as it's a financial gain. Now, I'll tell you at the end of the day, it will be, but like Pete Dawson said, it's a byproduct of really picking a direction. So
Absolutely.
When you say your why, your core focus, give us a little perspective on how that worked for you, because you're a restorative dentist, really unfunctional in a very small town, Lawrence, Kansas, out of network since when? How long were you out of network?
Since 1988.
Since 1988. And people want to move in that direction, but I always tell them, it's not as easy as just writing a letter or adjusting your fees. It's more about picking a path and becoming really good at something, because at the end of the day, some people have to reach into their pockets and they have to say, I'm seeking you out because you're really good at this and you're my person, right?
Right, exactly. So a couple of good points there. Yeah, differentiation is not just having, the shiniest object, the new shiny object. Differentiation is not just calling yourself an implant dentist and thinking you have the best system, a cosmetic dentist because you have the best ceramics or the ceramist, an airway dentist just because you want to focus on that. All of those things are important, and the most important thing you can become is an excellent diagnostician. Again, I'll go back to Dr. Dawson. He was just so wonderful in so many ways. But one of the most important things he told me is that you want to be a physician of the masticatory system. You don't have to be an expert in everything. You don't want to be an expert in everything, but you've got to be a good, the physician of the masticatory system and excellent in diagnosis. So when you think about your why, that has to cascade into your why is the practice why. My why is to assimilate complex things and distill it into a functional process and share it with others, right? So if that's my why, then my core values have to stem from that. They have to be, as you all do such a wonderful job with, integrated and co-authored with the team. And then that becomes the blueprint for every decision that's made. And so if you've got that hard stuff, I remember my wife and I went through marital therapy for a while, and it was great, because we got to understand each other. We had to learn how to communicate with each other without screaming. And so, but my therapist used to say, this is the hard stuff. You can't do this by email. Right. You've got to go through that process. Your ears have to hear your mouth say your why. Believe, your belief system has to be exuding from your mouth every single day. In this is how you develop it with your team. And then every system you develop, does that support your core values? Is it supporting what you want to do? So that's how we make decisions, and that's how the team becomes empowered to make decisions, because they know if they're making them in accordance and in harmony with the core values, they're good.
Yeah.
They may not make the right one, the one that you choose everyone all the time, but you know what the intention is.
Yeah, and this has been the theme of a lot of the last few podcasts that we've done. If you've been listening to the show, you know how important this is. It actually becomes the filter, the direction on how you make decisions. And I'll tell you, it's really, it comes into play with the hard decisions. So when you make a decision like how to differentiate, and you get this case that comes to your office, you're like, I should probably do this. Well, my core values tell me I shouldn't. And yet we still, we're caught in that moment. When you start to make decisions congruent with your value system and your core purpose, I'm telling you, people notice. The people that notice the most are your team members. And that's what I want to ask you is Jim, I totally get it if I'm listening to this, but I'm a dentist if I'm listening and I'm like, okay, listen, I got a big team or a small team. How do I use this with my team, and how do I get them to buy into this whole process?
Yeah, great question. And it's a journey that will never end. And it will go up and down in cycles depending on the composition of your team and your willingness to train them and spend the time to train and to discuss and to really clarify with them. But it is a process that has to be ongoing. And it has its challenge, like you said before. You have to be very clear. The primary goal of a business is to be profitable, and that has to be a primary goal of a practice. You're in business to be profitable. You're not going to be able to manifest your dream with empty pockets. That's all there is to it. You've got to make money. You've got to be profitable. You've got to be profitable to be able to sustain that team, to reward them, to have fun with what you're doing, to be able to organize your schedule the way you want. And so it becomes absolutely imperative that you spend almost as much time working on the practice as in the practice. And that's the hardest hurdle I've found people that I coach to overcome.
Right.
I mostly hand them off to you after I get them listening a little bit to me and say, here, these people teach you how, because I'm not that good at it. I'm good at listening to the dentist and trying to get their head screwed on straight.
Yeah, totally.
And getting them to do it, and then give them you guys to do work with the team, because I know that's not my strength, at all. Yeah. But you got to be willing to put the time in. You can't, for example, I'd say a more refined comprehensive care practice, the structure is very different. You've got to be able to block your schedule in ways to allow for some nuance, and yet have blocks to where you have productivity to satisfy the core business model as well. And there's a flow in that's between the behavioral and the technical that's very complex in a way. But the more you refine it, and the more your team understands the focus and what's required, and the communication that's required, the better it becomes. But it's time. I mean, you've got to take time to train them. I think your model of meetings with teams is very valid. Once a week to work on the core issues. I like morning huddles. I like an end of the day check-in really quick. What went well? What didn't? What do we need to talk about this week? Right. Just a real, because all that stuff just floats out there if you don't do something with it. But it's got to be always around the focus of the practice, and it just takes time and your willingness to train. I think systems drive the practice, people drive the systems. I think someone told me one time.
It's good stuff. Now talk about this. You mentioned before we hit the go button, the exceptional experience. So how does this relate when patients are choosing you? Differentiation. What are some of your big takeaways in designing that experience?
So the first thing I would say to any dentist that's listening is get over your fear of missing out. There is so much of that going on. Oh, if I don't learn to do tongue release, then I'm going to be left behind because the dentist down the street's doing them. Right. Get over that stuff. If I don't learn to place these implants, if I don't learn to focus on what is your strength and become the best at it that you can. And then let's put this back in the layers. The why first, the core value second, the systems now developed about making an exceptional experience. And the exceptional experience has to connect with people at a deep emotional level. People don't make decisions based on how good your margins are, the kind of ceramic you use, whether or not you use a CBCT or just work off of Panorex, or, what information you got. How come that you order MRIs and other people don't, name your thing. That's not differentiation. The exceptional practice is the practice that people walk through the door and they go, wow, well, let's back up. People call and at the end of the call, they go, wow, these people really care about my feelings, listened to me clearly, and made an appropriate appointment for me, which is not the same appointment for everyone.
Right. And
our schedule allows us to have blocks of time for all these different types of appointments that people would require, because an exceptional experience does in almost all circumstances is meet that person where they are, not trying to shoehorn them into what our ideal is.
Right.
And so from that experience, and then the minute they walk through the door, there is a personal interaction with them that says, we care about you. We love you. We love you being here. We're going to take good care of you. And that has just got to exude from everything you do. And if you can create that, and you won't hit a home run every time. I mean, we're all human. We miss it here and there. But it's like Jack Nicklaus used to say, that I don't do a lot of golf analogies because I'm a crappy golfer. But he used to say, I'd play a round of golf. And if I took, 68 shots, that would be my front nine usually. But if I took 68 shots, I might hit 2 of them exactly the way I wanted.
Right.
But the rest of them, I missed really well.
That's awesome.
And that's what you got to do. Miss it well if you're going to miss it, right?
Yeah.
Don't put yourself into a deep hole somewhere and into the sand trap you can't ever get out of. So the same thing in dentistry. Don't dig a big hole for yourself if you miss something. Same in the process. I'll tell you that the full disclosure, the cases I failed were the ones where I didn't communicate and I got ahead of myself and didn't meet the expectations of the patient. So communications and meeting and exceeding expectations are critical in that experience. And so you've got to design that so that it works. So I stayed, my practice focused on a lot of people with joint problems and some facial pain. I didn't want to get deep into facial pain with people with the psychological disorders or chronic facial pain where it became its own entity. But I could treat 90% of the people that came in with conservative therapy and then help them, help them structurally, help them get stable. So we had to design systems, and we were still restorative practice. So we had to design systems so that people came in at different points. If they were referred by somebody else who said, and have had a tough experience before resolving their pain, and they were coming to us, those people knew they needed significant dentistry, right? That appointment was very different than one was saying, well, I heard about you, that I looked you up on the internet and looked like you could treat this stuff. That's a different appointment. They don't have the same context coming in. That's a different appointment. People coming in from, through a hygiene visit or something of that nature, that's a different appointment. So we had to structure our schedule so that we accommodated people, but they always had, the experience that was appropriate for them. And it always was exceptional. You remember John Gordon? I don't know if you still talk to John.
Yeah.
Yeah. John used to have a line in his office. I love this. And they'd do a tour when people came in. Now you got to be careful, right? You can do a tour with a lot of patients, but you have a real heavy driver personality and you're walking through the office saying, this is our reception area. We don't keep people waiting, so you're not going to spend a lot of time there. This is our sterilization area. We have the highest standards of sterilization. We really take a lot of time. That's wonderful for a lot of people, but you get a driver in there and do that with them, they'll just walk out the door. You're going to frustrate them. Right. But so you've got to be very skilled on how you approach different people and approach them in an appropriate manner, understanding a little bit about social skills and behavior, right, as you're doing this. But he had the tour going through the office, and he was masterful with it. And he had a line at the back of the office when they were kind of going back into the bowel of the operation, the lab and the staff lounge. And he goes, by the time they crossed that line, our goal is to make sure that they would never go anywhere else for their care. Yeah. That experience walking through the office and seeing, and people greet the patient by name. Hygienists would look up from their patient perhaps and say, "Hi, Kirk, nice to see you. Thanks for being here." That sort of thing. And so that we adopted that process too. Tried to make sure that when somebody came in, they felt like they were the most important person there. Yeah. And for every practice, it's different. Depends on what you're focusing on. When we're doing it with restorative care and joint interface therapy, it's different. Yeah. And so you've got to structure it that way.
Yeah. And I remember going through that experience with John too. It was incredible. So I completely agree. And I don't remember all the details, but I remember how powerful it was when you would clearly explain to patients with such great passion why we're different. And patients would feel it. I mean, I felt it as he would hold those organizational trainings in his office. They were so beneficial. Yeah. So John, that was awesome. Yeah. Now, I want people to know a little bit more about what you guys are doing because I'm so passionate about you. Bill Robbins and Gary DeWood ultimately created or added energy to GDE. Can you explain what that is and how you guys make this a reality for dentists?
Well, it goes back again to the why, right? It goes back to, I think if you ask Gary or Bill, they would say about the same thing as I do. We're there to take to help dentists understand how to take complex care and integrate it in a way that's functional, it's doable, so that you can implement it. So, for example, we were talking about like the Botox thing the other day. That I saw the other day. Well, I had a patient recently that was out of joint surgery. She had a fat graft done on both joints. She has some instability in her bite, which is normal after the surgery. And the surgeon, Dr. Shaw and Forrest, said, why don't you try some Botox in this one muscle? Okay, let's try that, see if we can calm it down. I was working with my successor on the case, and I said, we'll try this and see. We went to the plastic surgeon, and they did the Botox because I don't do that anymore. And it helped for a day or two. Then it didn't. And the reason it didn't is because her bite was unstable. So I had Eric, my successor, just go back and stabilize her bite, and now the symptoms went away. And the reason was because we know that there's just not one tool in the toolbox. You got to have the whole toolbox. So how do you sort through that? Well, Bill Robbins and Jeff Rouse some years ago, as you know, and as our audience probably widely knows, it developed the global diagnosis model for interdisciplinary dentistry. 5 questions, 4 fundamental diagnoses, 6 tools. Very simple. Something that you can think about while you're chairside. We extended that now into the 5 core interfaces for occlusion. What do you need to look at? These are things that you normally look at, and how do you evaluate them? So we talk about the face, the bite, the joint, the teeth, and the airway, things that everyone wants to look at. So, for example, in the face, the question is there facial asymmetry? If there is, you evaluate it from frontal and sagittal views. Why is the facial asymmetry there? Are there changes in the bite? If there are, what does that look like? And again, the why questions come up. What's the origin of this? What is the root cause of that change? Bites just don't change on their own. Are there physical changes at the tooth level? We all see wear every day in our practices. Why is the wear where it is? If posterior teeth are worn and anterior teeth are not, what's the differentiation there? Is there change at the joint level that's creating that? And so the next phase is looking at changes at the joint level through all the different diagnostic tools that we have. And then is the airway stable? Because we know that the constricted bite is often an occlusion issue, is often a joint issue, and these things are all related. So if you can think about the things that you see every day in clinically, and that you obviously observe and observe them with more intention, and then have a process to sort through that, it makes your evaluation and diagnostic ability that much better. Right. So you have 5 interfaces that you can look at. You have 5 questions for the interdisciplinary side of it. You put those together, you get all your diagnostic information together, and then you can sort through, and now you can start to think about a treatment plan. You got to have time to do it, but at least it gives you a way to think about it in real time without having to, try to remember some complex Venn diagram of all the 67 different possibilities that this patient might have. You can do that later. You can sort through it later, but let's make it simple. So that's what we did. I tried to make the complex simple, which fit exactly with my purpose. And so that's why I love doing it. We have, two sessions every month where we present cases. Our members present cases. We talk about the organization and the treatment planning, and then the treatment itself, and how to apply it, in what sequence, in the right order, in what way. And then we have wonderful guest lecturers that come on all the time that just teach us so much about all different aspects of dentistry that it's just really exciting to be able to have those folks with us.
Yeah, I think it's so unique, and I'm biased because I love you guys. I've watched you not only your career's evolved, but your practices, and now you guys are in a really wonderful place in your career where you can start to give back, and you actually watch these dentists. You help them grow. You force them to think. They have to present. So it's not a course where you give a whole bunch of information. You actually, you watch them do this and how they think. Can you just speak to that just a little bit?
Sure. It's like I said before, we don't want to drown them in information and starve them for context, right?
Right.
You've got to have context around this. Yeah, we're not just there to lecture, because if you're just lecturing to an audience and you're not interacting and you're not overseeing and you're not mentoring, it's just entertainment. And there's a lot better ways to entertain ourselves. There's football games. We can go to those. There's a lot more fun things in entertainment in dentistry. So, what we are able to do is to follow up with people. And if you want to present, you can present. If you want to talk to us offline, talk to us offline. Some people get very tentative about presenting, but we encourage people to, be bold. We talk about our mistakes, our failures, and because we want to be transparent and authentic, and it's not just virtue signaling. We really care about, I'll show you all my mess ups so you don't do it.
Right.
'Cause none of us are perfect. And I think if, you learn by your mistakes, I should be a damn Einstein genius by now, but because I'm willing to put it out there. I don't care. So, but that's what we do. We support it. We have a master class like in occlusion with Jim McKee. Now he and I do one. And then we have mentoring that we can do with individual mentoring that we do with folks too. And we're there's not a day that goes by that somebody else can shoot me an email and says, "Hey, I got this case. What do you think?" Or I'm at this point and I'm trying to decide between whether to do aesthetic crown lengthening before the ortho finishes, or should I wait till afterwards, or should we extrude this tooth or extract it? Or should I use an implant? Do you think we should use an implant here, or should we do a bonded bridge? All those questions come up for us, and we're happy to answer them so that we give that support, because you've just got to be an active participant, in this team sport, and it is a team sport for us.
For sure. So if I'm listening to the podcast, well, first of all, I want you to send people where they might find more information about that and really step into this work. But before we do, give us some final thoughts.
Well, first, thank you for all you do. I mean, they don't tune into these things to hear people like me. They want to hear about you, because your life is really interesting, and you've built just a wonderful organization. So thanks a lot again. We just can't thank you enough for all you've done for us and all you've done for the profession. And that. I'm not just blowing smoke. That's true. And we just we appreciate that so much, and that's why we love hanging out with people like you. If I had to summarize it, I'd say, just three things. Number one, focus on your strength. Like we talked about earlier, find your strength, find what really is interesting for you, what really floats your boat, what really gets you excited, and focus on that. Figure out how to manifest that into your practice so that you can help people, because that's the first thing you're really there to do. Stay curious and stay informed. Stay curious always. There's not a day that goes by that I don't think about a case that I think, am I on track here? Is this the best option for this person, and why? Try to disprove yourself. I mean, that's kind of the scientific method, right? You have a theory of something, and then you're trying to, you got your theory, but you're trying to disprove the theory to see if it really holds water.
Right.
So stay curious. Always be learning. Always be listening. Stay curious and stay informed. Look for good information, not just stuff that is sort of flashy and fly by night. You can't learn this stuff in a webinar, a weekend course. It's something that you have to have a process for over time. What is it, 10,000 hours you have to put in to master something? And so that's a lot of time. Yeah. And dentistry is no different. You got to put the time in. But if you get focused, you don't have to try to put it in 6 different buckets. You just kind of focus it on one. And the third thing is just create that exceptional experience based on all of the things that we talked about. Yeah. And to do that, get support. Get ongoing support for you. That's one thing I didn't kind of get through the squash, until about 10 years of my practice. Hey, I need help here. I remember Elton John saying that in his concert, one day. He goes, I finally got to the point where I said, I need help. Of course, it was alcohol and drug addiction, but we all need help, right? So don't hesitate to ask for help. There are people out there who want to help you. It's an honor to be asked for help. When people send me an email about something, it's not bothering me. I say, well, hey, I'm happy to help. It's awesome. It's a very high compliment.
Amen.
So find people to support for you.
Yeah. And I would echo those sentiments exactly. If you're a dentist listening and you're like, this just sounds overwhelming, reach out to great people. I mean, one of the things I did when I first moved to Kansas City is I went to Jim Otten's office and he actually let me in, which was great. And
Lisa let you in. Yeah.
Well, and I think it just speaks, number one, it speaks to your character. Number two, this is how this great profession works, is like, it's a very noble profession of people that want to help you. They want to see you succeed. So don't struggle quietly. It's too hard. There's a lot of people that are willing to help. So Jim, I'm so grateful for you, buddy. I'm excited for what you guys are doing at GDE. Thanks for being on, brother. Appreciate you.
Thank you for having me again. And anybody wants more information, they can write to me, jottendds@gmail.com. We can post it in the show notes. And then look at our website, globaldiagnosiseducation.org. Feel free to reach out. Happy to help any way I can. Thanks, brother.
Dude, you're the best. So stick around while we say goodbye to everybody else. But thank you guys for listening to the Best Practices Show. Hey, if you enjoyed today, do us a favor. Keep sharing this. Share this episode. Share everything. Keep sharing ideas that you guys want.
Be curious.
Be curious. We're going to find the experts. I love this stuff. I love the education, and we're going to keep bringing it with great minds, great teachers, just like today, and help you create a better practice and a better life. So keep tuning in. So until we see you guys next time, or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.